Hi, I'm Dr. Peter Goh, Professor of Surgery at Monash University. The diabetes problem in the world is huge today. There are 425 million people with diabetes in the world. This excludes the patients who are not diagnosed with diabetes and the pre-diabetic patients, who are almost just as many. In Singapore, there are 400,000 to 500,000 diabetics which are diagnosed already. So it's a $1 trillion problem to the world, and it's a $1 trillion industry. Medical circles around the world agree that surgery or metabolic surgery is the best treatment for diabetes today. In dozens of randomized controlled trials, it is proven that surgical treatment gives a far better result than even the best medical treatment together with lifestyle changes. Metabolic surgery works by changing the hormones in the body. Insulin is not the only hormone that controls blood sugar. There are other gut hormones that control blood sugar. Metabolic surgery reduces the hormones that increase blood sugar and increases the hormones that reduce blood sugar, increase insulin production, and decrease insulin resistance. In a large number of cases, diabetes is resolved within a few days. The results of metabolic surgery are dramatic. A lot of patients will get off insulin and medical treatment within 3 or 4 days after the operation. A lot of patients also get off oral medication at this time, but some patients require oral medication for 6 months to a year, and then they will be able to get off all medication completely. Generally, the patients will have very improved blood sugar profile and also reverse many of their diabetic complications. So the results are quite amazing. The operations are done by keyhole surgery, so there's minimal pain, and the downtime is very short as well. Hospitalization is only 2 nights. There isn't very much pain associated with the operation, and the recovery is very quick. Most patients can drink after 1 day after the operation, can walk around almost immediately and be discharged on the 2nd day. The complication rate is about 1%, but most of the complications can be treated without resolving to further surgery. Most of the patients will have to eat a smaller meal and have early satiety after the surgery, and they will have to take vitamins. Other than that, there are very few downsides to these operations. Some of the greatest benefits are the resolution of diabetic complications. Diabetic retinopathy will improve, and patients will have improved eyesight. Diabetic kidney disease will also improve, and the patients have improved renal function usually after the operation. Some patients with diabetic feet and sores and ulcers on the legs will heal and avoid amputation. Patient's sex life will also improve tremendously, and the patient will be protected from heart disease and stroke. Patients who have had diabetes for not so many years, for instance less than 20 or even better, less than 10 years, will benefit tremendously from these operations. The shorter the duration of diabetes, the more likely that the diabetes will completely reverse. But those patients who are on insulin also benefit a great deal because they generally get off insulin. They don't have to inject themselves anymore. Most patients after metabolic surgery will be diabetes-free for 10 years or more. Some patients will have recurrence, but the recurrences are usually mild, and patients can then just take a little bit of oral medication to resolve the diabetes. But most importantly, they will have a 50% reduction in diabetic complications as resulting from the surgery. This surgery is endorsed by medical, diabetic, and surgical societies from all over the world. They all recognize that surgery is now the best treatment for diabetes rather than medicine. Unfortunately, many doctors have still not heard of this type of surgery and consider that diabetes is a medical problem and lifelong problem. The reason that nobody has heard about it is that many doctors still don't know that this treatment exists. Some do, but because they don't know much about the surgery, think that it is dangerous and don't advise their patients to go for it. But this is also false. And some are not telling their patients out of vested interest because they still want to have an income from selling diabetic drugs and consulting on these diabetic patients, treating them medically. I have a message for all patients with type 2 diabetes. Your condition need not be lifelong. You can reverse your disease. A simple surgical procedure can change your life tremendously, and you can have a healthier and happier life.